Question 1. The efficiency study reveals that the EFDA time spent on patient examinations is a key factor in clinic workflow. During a routine examination, the EFDA identifies a small, asymptomatic, discolored spot on the buccal mucosa that is not immediately identifiable as a common lesion. The EFDA also notes a slight roughness on the occlusal surface of a posterior tooth that does not appear to be active caries. Considering the need for thoroughness and patient safety, what is the most appropriate course of action? Option A. Ignore the discolored spot on the mucosa as it is asymptomatic and likely benign, and focus only on the rough occlusal surface, probing it to determine if it is active decay. Option B. Document only the rough occlusal surface, as this is a more common finding for an EFDA to address, and advise the patient to monitor the discolored spot themselves. Option C. Immediately refer the patient to a specialist for evaluation of the discolored spot, and schedule a follow-up appointment for the patient to address the occlusal surface. Option D. Document the discolored spot and the rough occlusal surface, noting their asymptomatic nature and lack of immediate identification, and bring these findings to the attention of the supervising dentist for further evaluation. Correct answer is D. Document the discolored spot and the rough occlusal surface, noting their asymptomatic nature and lack of immediate identification, and bring these findings to the attention of the supervising dentist for further evaluation. Explanation: this scenario is professionally challenging because the expanded functions dental assistant EFDA is tasked with a critical diagnostic step that directly impacts patient care and treatment planning. The visual and tactile examination requires not only technical skill, but also keen observation, critical thinking, and adherence to established protocols to ensure accuracy and patient safety. The EFDA must discern subtle abnormalities from normal anatomical variations, which demands a thorough understanding of oral anatomy and pathology. The correct approach represents best professional practice because it prioritizes patient well-being and aligns with the scope of practice for an EFDA as defined by insert-specific U.S. State Dental Practice Act or relevant regulation, e.g., the California Dental Practice Act, Section 1750. 1. This approach involves systematically examining all surfaces of the teeth and surrounding soft tissues, noting any deviations from normal, and documenting findings accurately. This meticulous process ensures that potential issues are identified early, allowing for timely intervention and appropriate referral to the supervising dentist. Ethical practice dictates that the EFDA acts within their authorized scope, utilizing their training to contribute to comprehensive patient assessment. An incorrect approach that involves rushing the examination or focusing only on obvious signs of decay would be a regulatory and ethical failure. This would violate the requirement for a thorough examination as mandated by insert-specific U.S. State Dental Practice Act or relevant regulation. Such an approach could lead to misdiagnoses, delayed treatment, and potential harm to the patient, thereby breaching the duty of care owed to the patient. Another incorrect approach, such as relying solely on patient self-reporting without independent verification, would also be a failure. The EFDA role is to provide an objective assessment, and neglecting this responsibility undermines the diagnostic process and the dentist's ability to make informed treatment decisions. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements for their scope of practice. This involves a systematic review of the patient's oral cavity, utilizing both visual inspection and tactile exploration. The process should be guided by a checklist or protocol that ensures all areas are examined. Any findings should be compared against established norms and potential pathologies. Documentation of all findings, both normal and abnormal, is crucial. Finally, any significant findings or concerns should be immediately communicated to the supervising dentist for further evaluation and treatment planning. Question 2. To address the challenge of optimizing the workflow for a specific restorative procedure, a dentist suggests the EFDA bypass a particular step in the material preparation phase, stating it is not critical for this instance. What is the most appropriate course of action for the EFDA? Option A. Immediately proceed with the dentist's instruction to expedite the process, trusting their judgment implicitly. Option B. Suggest an alternative method for material preparation that is not standard but might be faster, without consulting the dentist or regulatory guidelines. Option C. Refuse to deviate from the standard procedure, citing personal preference for established protocols without further discussion. Option D. Politely inquire about the specific rationale behind the suggested bypass and confirm it aligns with current dental board regulations and established best practices for the procedure before proceeding. Correct answer is D. Politely inquire about the specific rationale behind the suggested bypass and confirm it aligns with current dental board regulations and established best practices for the procedure before proceeding. Explanation. This scenario presents a professional challenge because it requires the expanded functions dental assistant EFDA to balance efficiency with patient safety and adherence to established protocols. The dentist's request, while seemingly aimed at streamlining a process, could potentially compromise the quality of care or introduce risks if not handled with careful judgment and a thorough understanding of the EFDA scope of practice and the underlying principles of the procedure. The correct approach represents best professional practice because it prioritizes patient well-being and regulatory compliance. By seeking clarification and ensuring all necessary steps are followed according to established dental board regulations and best practices for the specific procedure, the EFDA upholds their professional responsibility. This proactive communication ensures that the proposed shortcut does not violate any guidelines, compromise the integrity of the treatment, aligning with the ethical obligation to provide competent and safe dental care. An incorrect approach that involves immediately proceeding with the dentist's suggestion without verification would be a significant regulatory and ethical failure. It demonstrates a lack of critical thinking and an abdication of the EFDA responsibility to ensure procedures are performed correctly and safely. This could lead to suboptimal patient outcomes, potential harm, and violations of the Dental Practice Act, which outlines the scope of practice for EFDA and mandates adherence to established protocols. Another incorrect approach, such as refusing to consider any modification without understanding the rationale, might be seen as uncooperative and could hinder efficient practice if the dentist's suggestion was indeed valid and safe. However, the primary failure lies in bypassing established safety and quality checks. Professionals should employ a decision-making framework that involves 1. Understanding the request and its potential implications. 2. Consulting relevant regulations, practice guidelines, and the dentist's established protocols. 3. Seeking clarification from the supervising dentist regarding any deviations from standard procedure. 4. Assessing the potential impact on patient safety and treatment efficacy. And 5. Acting in a manner that upholds professional standards and patient welfare. Question 3. Compliance review shows that during a routine dental appointment, an expanded functions dental assistant EFDA noted that patient's blood pressure reading was significantly elevated compared to their previous visit, and the patient reported feeling slightly lightheaded. The EFDA is preparing to begin a restorative procedure. What is the most appropriate immediate action for the EFDA to take? Option A. Advise the patient to take deep breaths and try the blood pressure reading again later, then proceed with the procedure if the reading normalizes. Option B. Immediately inform the supervising dentist of the elevated blood pressure reading and the patient's reported symptom before proceeding with any treatment. Option C. Proceed with the restorative procedure as scheduled, assuming the elevated reading is a temporary anomaly. Option D. Document the elevated blood pressure and the patient's symptom but wait until after the procedure to inform the dentist. The correct answer is B. Immediately inform the supervising dentist of the elevated blood pressure reading and the patient's reported symptom before proceeding with any treatment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the expanded functions dental assistant EFDA to move beyond routine tasks and exercise critical judgment in a situation with potential patient safety implications. Recognizing abnormal vital signs is not merely about measurement. It involves understanding the context of the patient's condition and the potential impact on dental treatment. The EFDA must balance the need to proceed with treatment against the imperative to ensure patient well-being, which can involve difficult communication with the supervising dentist. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety, a cornerstone of dental ethics and regulatory compliance. By recognizing the abnormal vital signs and immediately communicating them to the supervising dentist, the EFDA is fulfilling their professional responsibility to act in the patient's best interest. This aligns with the ethical obligation to avoid harm and the regulatory requirement for EFDA to work within their scope of practice, which often includes recognizing and reporting deviations from normal patient status. Prompt communication allows the dentist to make an informed decision about modifying or postponing treatment, thereby preventing potential complications. Incorrect approach is analysis. An incorrect approach of proceeding with treatment without informing the dentist is a significant regulatory and ethical failure. It violates the principle of do no harm and demonstrates a lack of professional judgment. This could lead to patient injury, for which the EFDA and the supervising dentist could be held liable. It also represents a failure to adhere to the scope of practice, as EFDA are typically not authorized to make independent treatment decisions in the face of abnormal vital signs. Another incorrect approach of delaying reporting until after the procedure is also a serious ethical and regulatory lapse. This delays necessary intervention and increases the risk of adverse patient outcomes. It demonstrates a disregard for patient well-being and a failure to uphold professional standards of care. Finally, an incorrect approach of dismissing the abnormal vital signs as insignificant without further investigation or reporting is a failure of due diligence. Vital signs are objective indicators of a patient's physiological status, and ignoring them can have severe consequences. This approach demonstrates a lack of critical thinking and a potential disregard for patient safety, which is a direct violation of professional responsibilities. Professional reasoning. Professionals should employ a systematic decision-making process when encountering abnormal vital signs. This involves 1. Accurate measurement and recording of vital signs. 2. Comparison of findings against established normal ranges and the patient's baseline if known. 3. Critical assessment of the patient's overall presentation and any reported symptoms. 4. Immediate and clear communication of findings to the supervising dentist, including any observed changes or concerns. 5. Following the dentist's instructions regarding further assessment or modification of treatment. This process ensures that patient safety remains paramount and that all actions are taken within the established scope of practice and ethical guidelines. Question 4. Process analysis reveals that during a routine dental procedure, a patient suddenly becomes unresponsive, exhibits shallow breathing, and has a weak, thready pulse. The dentist is momentarily out of the operatory. What is the most appropriate immediate course of action for the expanded functions dental assistant EFDA present? Option A. Begin advanced cardiac life support ACLS procedures independently as the dentist is not present. Option B. Immediately alert the dentist. Direct another staff member to call Emergency Medical Services (EMS) and prepare to assist with basic life support if trained. Option C. Attempt to administer an over-the-counter medication from the office supply to stabilize the patient while waiting for the dentist. Option D. Wait for the dentist to return to the operatory before taking any action to avoid overstepping professional boundaries. The correct answer is B. Immediately alert the dentist, direct another staff member to call Emergency Medical Services (EMS), and prepare to assist with basic life support if trained. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the expanded functions dental assistant EFDA to act decisively and competently in a high-stress, time-sensitive situation where patient well-being is immediately at risk. The EFDA must quickly assess the situation, recognize the signs of a serious medical emergency, and initiate appropriate protocols while the dentist may be occupied or unavailable. This demands not only knowledge of emergency procedures, but also the ability to remain calm, communicate effectively, and delegate tasks appropriately within their scope of practice. Correct approach analysis. The correct approach prioritizes immediate patient safety and adherence to established emergency protocols. This involves recognizing the signs of a medical emergency, alerting the dentist immediately, and initiating basic life support measures if trained and indicated, while simultaneously directing a staff member to call Emergency Medical Services (EMS). This aligns with the ethical obligation to provide competent care and the regulatory framework that mandates EFDA to be prepared to assist in medical emergencies. Prompt notification of the dentist ensures that the primary provider is aware and can take charge of the clinical management of the emergency. Directing another staff member to call EMS ensures that professional medical help is en route without delay. Incorrect approaches analysis. One incorrect approach would be to delay alerting the dentist or initiating any action, perhaps due to uncertainty or a desire to avoid overstepping boundaries. This failure to act promptly constitutes a breach of the EFDA duty of care and could have severe consequences for the patient. Ethically, it demonstrates a lack of commitment to patient safety. Regulationally, it may violate guidelines requiring dental personnel to be prepared for emergencies. Another incorrect approach would be to attempt to manage the emergency solely without involving the dentist or calling for external medical assistance. This is incorrect because the EFDA scope of practice, while expanded, does not typically include independent advanced medical management of severe emergencies. It also bypasses the dentist's ultimate responsibility for patient care and the critical need for professional medical intervention from EMS. This approach violates regulatory limitations on practice and ethical principles of appropriate delegation and collaboration. A third incorrect approach might be to panic and freeze, failing to take any decisive action. While understandable in a stressful situation, this is professionally unacceptable. It directly compromises patient safety and demonstrates a lack of preparedness, which is a core expectation for EFDA in managing medical emergencies. Regulatory bodies expect dental professionals to have a plan and execute it, even under duress. Professional reasoning. When faced with a potential medical emergency, the professional decision-making process should follow a clear hierarchy. 1. Recognize the signs and symptoms of a medical emergency. 2. Immediately alert the supervising dentist. 3. Initiate appropriate emergency protocols within the EFDA scope of practice, e.g., basic life support if trained. 4. Ensure emergency medical services are contacted without delay. 5. Follow the dentist's instructions and assist as directed. This systematic approach ensures that patient needs are met efficiently and effectively, adhering to both ethical responsibilities and regulatory requirements. Question 5. Governance review demonstrates a need to reinforce protocols for expanded functions dental assistance, EFDA, regarding patient oral health observation. During a routine prophylaxis, an EFDA notes a small, asymptomatic, non-ulcerated, slightly raised, white patch on the lateral border of the patient's tongue. The patient reports no history of trauma to the area and has not noticed the patch themselves. What is the most appropriate course of action for the EFDA? Option A. Inform the patient that it appears to be a precancerous lesion and recommend they seek immediate referral to an oral surgeon. Option B. Advise the patient that it is likely a minor irritation and to monitor it for a few weeks, reporting back if it changes. Option C. Make a note in the chart to check the lesion at the patient's next appointment in 6 months, assuming it is benign. Option D. Document the observation thoroughly, including its characteristics and location, and immediately report it to the supervising dentist for evaluation. Correct answer is D. Document the observation thoroughly, including its characteristics and location, and immediately report it to the supervising dentist for evaluation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the expanded functions dental assistant EFDA to exercise critical judgment in identifying potential signs of oral cancer or other pathologies. The challenge lies in distinguishing between common, benign oral conditions and potentially serious lesions that necessitate further investigation by a dentist. The EFDA role is supportive, but their observational skills are crucial for early detection, which significantly impacts patient prognosis. This demands a high level of clinical awareness and adherence to established protocols for reporting findings. Correct approach analysis. The correct approach involves meticulously documenting all observed abnormalities, including their location, size, color, texture, and any associated symptoms reported by the patient. This documentation should then be promptly and clearly communicated to the supervising dentist. This represents best professional practice because it aligns with the EFDA scope of practice, which includes assisting in patient assessment and recognizing deviations from normal oral conditions. Ethically, it fulfills the duty of care to the patient by ensuring that potentially serious findings are not overlooked and are brought to the attention of the primary clinician for diagnosis and management. Regulatory frameworks for EFDA typically mandate reporting of such observations to the dentist. Incorrect approaches analysis. One incorrect approach is to dismiss any unusual findings as minor or temporary without thorough documentation and reporting. This is a regulatory and ethical failure, because it can lead to delayed diagnosis of serious conditions like oral cancer, potentially harming the patient and violating the duty of care. It also fails to uphold the professional responsibility to observe and report. Another incorrect approach is to attempt to diagnose the condition or provide treatment recommendations directly to the patient. This is a significant regulatory and ethical failure as it exceeds the EFDA scope of practice. Diagnosing and prescribing treatment are the exclusive responsibilities of the licensed dentist. Such actions could lead to misdiagnosis, inappropriate treatment, and legal repercussions for both the EFDA and the dental practice. A third incorrect approach is to only report findings that appear overtly alarming or symptomatic. This is a failure in professional judgment and adherence to best practices. Many early-stage oral cancers or pathologies may present subtly. The EFDA role is to observe and report all deviations from normal, allowing the dentist to make the determination of significance. Failing to report subtle changes can also lead to delayed diagnosis. Professional reasoning. Professionals should employ a systematic approach. First, maintain a high level of vigilance during all patient interactions, paying close attention to the oral tissues. Second, develop a thorough understanding of common oral pathologies and their visual characteristics, as well as the typical presentation of early-stage oral cancer. Third, consistently and accurately document all observations, no matter how minor they may seem. Fourth, adhere strictly to the practice's established protocol for reporting unusual findings to the supervising dentist. Finally, understand the boundaries of one's scope of practice and always defer diagnostic and treatment decisions to the dentist. Question 6. Consider a scenario where a patient, Mrs. Gable, has just received a diagnosis of moderate periodontal disease from the dentist. The dentist has outlined a treatment plan involving scaling and root planing, followed by a 6-month maintenance schedule. As the expanded functions dental assistant, EFDA, you are tasked with explaining this treatment plan to Mrs. Gable. She appears anxious and asks, "Are you sure this is the only way? My neighbor said she had a similar problem and just used special mouthwash and it cleared right up." How should you respond to Mrs. Gable? Option A. Suggest that while mouthwash can be helpful for general oral hygiene, it is generally not sufficient to treat moderate periodontal disease, and that the dentist's recommended procedure is the standard of care for her condition. Option B. Advise Mrs. Gable that the dentist's plan is the best option, and that alternative treatments like mouthwash are not effective for her situation, implying that her neighbor's experience might not be comparable. Option C. Explain the proposed treatment plan in detail, including the rationale behind scaling and root planing for her specific condition, and reassure her that the dentist has determined this is the most effective course of action. Offer to schedule a follow-up discussion with the dentist if she has further questions or concerns about the recommended treatment. Option D. Tell Mrs. Gable that you understand her concern and that you will relay her question about alternative treatments, specifically mouthwash, to the dentist, and that the dentist will discuss this with her. The correct answer is C. Explain the proposed treatment plan in detail, including the rationale behind scaling and root planing for her specific condition, and reassure her that the dentist has determined this is the most effective course of action. Offer to schedule a follow-up discussion with the dentist if she has further questions or concerns about the recommended treatment. Explanation. This scenario presents a professional challenge due to the inherent power imbalance between a dental professional and a patient, and the ethical imperative to ensure informed consent. The EFDA role in explaining treatment plans requires a delicate balance of providing clear, understandable information without overstepping the scope of practice or making definitive treatment recommendations that are the dentist's responsibility. The dentist has the ultimate authority and responsibility for diagnosing conditions and prescribing treatment. The EFDA role is to support the dentist by conveying information accurately and empathetically, ensuring the patient comprehends the proposed course of action, potential risks, benefits, and alternatives. The correct approach represents best professional practice because it adheres to the principles of patient autonomy and informed consent, which are foundational to ethical dental care. By accurately relaying the dentist's proposed treatment plan, answering factual questions within their scope, and facilitating further discussion with the dentist, the EFDA empowers the patient to make an informed decision. This aligns with regulatory frameworks that emphasize clear communication and patient education as integral to the delivery of dental services. It also upholds the professional boundaries between the EFDA and the dentist, ensuring that diagnostic and prescriptive responsibilities remain with the licensed dentist. An incorrect approach, where the EFDA attempts to diagnose the patient's condition or independently recommend alternative treatments, would constitute a violation of professional scope of practice regulations. This could lead to misdiagnosis, inappropriate treatment, and potential harm to the patient, as well as disciplinary action against the EFDA and potentially the supervising dentist. Another incorrect approach, such as overwhelming the patient with overly technical jargon or minimizing potential risks, would fail to achieve true informed consent. This breaches the ethical duty of honesty and transparency, undermining patient trust and potentially leading to dissatisfaction or adverse outcomes. Professionals should approach such situations by first understanding the dentist's proposed treatment plan thoroughly. They should then prepare to communicate this plan in clear, patient-friendly language, using visual aids if appropriate. The focus should be on conveying information, not making decisions. If a patient asks questions beyond the EFDA scope or expresses significant concerns, the professional should acknowledge these and promptly involve the supervising dentist. This decision-making process prioritizes patient understanding, safety, and adherence to regulatory and ethical standards. Question 7. The investigation demonstrates that an expanded functions dental assistant EFDA is preparing to perform a restorative procedure. During the pre-procedure review of the patient's electronic medical record, the EFDA notices a recent notation of a significant cardiac event, but the patient's current medical history form, completed by the patient, does not mention any cardiac issues. The supervising dentist has instructed the EFDA to proceed with the procedure as planned. What is the most appropriate course of action for the EFDA? Option A. Ask the patient directly about their cardiac event, bypassing the dentist's instructions. Option B. Politely inform the supervising dentist of the discrepancy between the electronic medical record and the patient's self-reported history, and request clarification on how to proceed, emphasizing the potential implications of the cardiac event for the planned procedure. Option C. Proceed with the procedure as instructed by the dentist, assuming the dentist has reviewed all information and deemed it safe. Option D. Document the discrepancy but proceed with the procedure without further discussion with the dentist, assuming the dentist is aware. The correct answer is B. Politely inform the supervising dentist of the discrepancy between the electronic medical record and the patient's self-reported history, and request clarification on how to proceed, emphasizing the potential implications of the cardiac event for the planned procedure. Explanation. This scenario presents a professional challenge because the expanded functions dental assistant EFDA is faced with conflicting information regarding a patient's medical history, which directly impacts the safety and appropriateness of the planned dental procedure. The EFDA has a professional and ethical obligation to ensure patient safety, which includes having accurate and complete medical information. The dentist's directive, while seemingly straightforward, could lead to an adverse event if the patient's undisclosed condition is significant. Careful judgment is required to balance the dentist's instructions with the EFDA responsibility for patient well-being and adherence to regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient safety and upholds the EFDA duty of care. By seeking clarification and ensuring the dentist is fully aware of the potential implications of the patient's medical history, the EFDA acts in accordance with the principles of informed consent and prudent medical practice. This aligns with regulatory frameworks that mandate EFDA to operate within their scope of practice and to report any concerns that could compromise patient care. It also reflects the ethical imperative to act in the patient's best interest, even when it requires questioning a superior's initial directive. An incorrect approach of proceeding with the procedure without further clarification would be a significant regulatory and ethical failure. It demonstrates a disregard for the potential risks associated with the patient's undisclosed medical condition, violating the principle of do no harm. This could lead to patient injury, professional disciplinary action, and legal repercussions. Another incorrect approach of ignoring the discrepancy and assuming the dentist is aware of all implications would be negligent. It abdicates the EFDA responsibility to actively participate in patient safety protocols. Finally, directly contradicting the dentist without first attempting to understand their reasoning or ensure they have all the information would be unprofessional and could damage the dentist-EFDA working relationship, though the primary failure remains the potential compromise of patient safety. Professional decision-making in such situations requires a systematic approach. First, identify the discrepancy or potential risk. Second, gather all relevant information. Third, assess the potential impact on patient safety. Fourth, communicate concerns clearly and professionally to the supervising dentist, providing specific reasons for the concern. Fifth, document the communication and the resolution. And sixth, if concerns remain unaddressed, and patient safety is still at risk. Follow established protocols for escalating the issue within the practice or to the relevant regulatory body. Question 8. Upon reviewing a periapical radiograph of a patient, you observe a distinct radiopaque lesion at the apex of a non-vital tooth, exhibiting irregular margins and a subtle internal radiolucent component. This finding is not consistent with typical periapical bone patterns. What is the most appropriate action for an EFDA to take in this situation? Option A. Immediately alert the supervising dentist to the presence and characteristics of the observed radiographic finding. Option B. Conclude that the finding is likely a normal anatomical variation and proceed with other duties. Option C. Attempt to definitively diagnose the nature of the radiopaque lesion based on your knowledge. Option D. Document the finding in the patient's chart as a minor anomaly without further comment. The correct answer is A. Immediately alert the supervising dentist to the presence and characteristics of the observed radiographic finding. Explanation. This scenario presents a professional challenge because the expanded functions dental assistant EFDA is tasked with interpreting radiographic findings, a responsibility that requires a keen eye for detail and a solid understanding of both normal anatomical structures and potential pathological indicators. The EFDA must exercise careful judgment to differentiate between benign variations and signs of disease that necessitate further investigation by the supervising dentist. This requires not only technical proficiency in image interpretation, but also an awareness of the scope of practice and the importance of timely and accurate reporting. The correct approach represents best professional practice because it aligns with the EFDA expanded scope of practice, which includes assisting the dentist in diagnosis by identifying and reporting potential abnormalities. By recognizing a radiographic finding that deviates from normal anatomy and promptly bringing it to the attention of the supervising dentist, the EFDA fulfills their ethical and regulatory obligation to contribute to patient care and facilitate early detection of oral health issues. This proactive communication ensures that the dentist can make an informed diagnostic and treatment plan, ultimately benefiting the patient. An incorrect approach of dismissing the finding as insignificant would be a significant regulatory and ethical failure. It demonstrates a lack of diligence and a failure to adhere to the standard of care expected of an EFDA. This could lead to delayed diagnosis and treatment, potentially compromising patient outcomes and exposing the EFDA and the dental practice to liability. Another incorrect approach of attempting to diagnose the condition independently would exceed the EFDA scope of practice, which is a direct violation of regulatory guidelines. The EFDA role is to identify and report, not to diagnose. The professional decision-making process for similar situations should involve a systematic review of the radiograph, comparing findings against established anatomical norms and common pathological presentations. If any deviation is noted, the EFDA should consult relevant resources or protocols if available, and then clearly and concisely communicate the observation to the supervising dentist, highlighting the specific area of concern. This collaborative approach ensures that patient care is prioritized and that all findings are appropriately addressed within the established legal and ethical framework. Question 9. Operational review demonstrates that an expanded functions dental assistant EFDA is tasked with removing a sectional matrix band from a recently placed composite restoration. The EFDA notes some slight adherence of the composite to the matrix band. What is the most appropriate risk mitigation strategy to prevent damage to the restoration during matrix removal? Option A. Immediately attempt to pry the matrix band away from the restoration using a dental scaler, assuming the composite will break cleanly from the band. Option B. Apply firm, steady pressure to detach the entire matrix band from the tooth in one swift motion to minimize the time the composite is under stress. Option C. Use a high-speed handpiece with a finishing burr to quickly grind away any composite material that appears to be adhering to the matrix band before attempting removal. Option D. Gently and incrementally loosen the matrix band from the tooth, observing for any signs of composite lifting or distortion, and using a dental explorer to carefully free any minor composite adherence at the margins before complete removal. Correct answer is D. Gently and incrementally loosen the matrix band from the tooth, observing for any signs of composite lifting or distortion, and using a dental explorer to carefully free any minor composite adherence at the margins before complete removal. Explanation. The scenario of removing matrix systems without damaging restorations presents a professional challenge due to the inherent risk of iatrogenic damage. Restorations, particularly composite resins and glass ionomers, are susceptible to chipping, fracturing, or surface abrasion during matrix removal. The dental assistant's role in this process requires a delicate balance of efficiency and precision to ensure the integrity of the restorative work. This is critical for patient outcomes, as damaged restorations may require premature replacement, leading to increased treatment time, cost, and potential patient discomfort. Adherence to established protocols and a thorough understanding of material properties are paramount. The correct approach represents best professional practice because it prioritizes patient safety and the preservation of dental work. This involves a systematic, controlled removal technique that minimizes stress on the restoration. Utilizing appropriate instruments, applying controlled force, and observing the restoration's margins and surface throughout the process are key. This aligns with the ethical obligation to provide competent and careful dental care, as mandated by professional standards and regulatory bodies governing dental auxiliaries. The focus is on preventing harm and ensuring the longevity and aesthetic quality of the restoration. An incorrect approach involving forceful or hasty removal of the matrix system fails to uphold professional standards. Such actions could lead to direct damage to the restoration, constituting a breach of the duty of care owed to the patient. This could be interpreted as negligence, as it deviates from accepted standards of practice and potentially causes harm. Furthermore, it demonstrates a lack of understanding of the materials being worked with and the potential consequences of improper technique, which could violate regulations requiring EFDA to perform duties within their scope of practice and with appropriate skill. Another incorrect approach might involve using instruments not designed for matrix removal or using them in a manner that could gouge or scratch the restoration. This demonstrates a lack of preparedness and attention to detail, again risking damage to the restoration. Ethically, this is unacceptable as it falls short of the expected level of care. Regulatory frameworks often require dental professionals to maintain proficiency and use appropriate tools for all procedures. The professional decision-making process for similar situations should involve a pre-procedure risk assessment. This includes identifying the type of restoration, the matrix system used, and any potential challenges. During the procedure, constant visual monitoring of the restoration is essential. If resistance is encountered, the assistant should pause, reassess the situation, and adjust their technique or seek guidance from the supervising dentist rather than proceeding with excessive force. This iterative process of assessment, action, and reassessment is fundamental to safe and effective dental practice. Question 10. Examination of the data shows a dental radiograph exhibiting significant overlapping of the interproximal surfaces of two adjacent posterior teeth, and the image also displays a noticeable cone cut along the incisal edge of one of the teeth. Considering the expanded functions, dental assistant, EFDA, role in ensuring diagnostic quality, which of the following actions best reflects adherence to professional standards and regulatory guidelines for assessing radiographic quality and identifying errors? Option A. Attempt to digitally enhance the overlapping areas and the cone-cut region to improve visibility before submitting the image. Option B. Submit the radiograph with a note indicating the presence of overlapping and cone cutting, leaving the diagnostic interpretation solely to the dentist. Option C. Retake the radiograph to ensure accurate visualization of all tooth surfaces and surrounding bone, as both overlapping and cone cutting compromise diagnostic clarity. Option D. Accept the radiograph as it is, assuming the dentist can still identify gross pathology despite the technical imperfections. The correct answer is C. Retake the radiograph to ensure accurate visualization of all tooth surfaces and surrounding bone, as both overlapping and cone cutting compromise diagnostic clarity. Explanation. Scenario analysis. This scenario is professionally challenging because assessing radiographic quality requires a nuanced understanding of both technical factors and their impact on diagnostic accuracy. An expanded functions dental assistant EFDA must not only identify visible artifacts, but also comprehend how these imperfections can obscure critical diagnostic information, potentially leading to misdiagnosis or delayed treatment. The responsibility lies with the EFDA to ensure that the radiographic images are of sufficient quality for the dentist to make informed clinical decisions, adhering to established standards of care. This requires a proactive approach to quality control, rather than a passive acceptance of any image produced. Correct approach analysis. The correct approach involves a systematic evaluation of the radiograph against established quality criteria. This includes checking for proper density and contrast, ensuring the entire area of interest is captured without distortion or elongation, and verifying the absence of artifacts such as cone cuts, overlapping, or smudging. Critically, EFDA must assess whether any identified technical flaws compromise the diagnostic value of the image. If a flaw is present and impacts diagnostic clarity, the image must be retaken. This aligns with the ethical obligation to provide competent patient care and the regulatory requirement to maintain accurate and reliable patient records, which includes diagnostic imaging. The EFDA role is to support the dentist by providing high-quality diagnostic aids. Incorrect approaches analysis. Accepting a radiograph with significant cone cutting, where the X-ray beam was not centered on the tooth, is professionally unacceptable. This error directly obscures portions of the tooth and surrounding bone, hindering the dentist's ability to accurately assess for decay, bone loss, or other pathology. This failure violates the principle of providing competent care and can lead to a breach of the standard of care. Submitting a radiograph with excessive elongation, where the X-ray beam was angled too steeply, is also professionally unacceptable. Elongation distorts the tooth's anatomy, making it difficult to accurately measure root length or assess interproximal spaces for decay. This misrepresentation of anatomical structures compromises diagnostic accuracy and falls short of the expected standard for diagnostic imaging. Approving a radiograph with overlapping contacts, where adjacent teeth are superimposed, is another failure. This error can mask interproximal decay or other pathology between teeth, leading to misdiagnoses and potential harm to the patient. The EFDA responsibility includes ensuring that all relevant anatomical structures are clearly visualized. Professional reasoning. When faced with a radiograph, the professional decision-making process should involve a checklist of quality parameters. First, visually inspect for gross errors like cone cutting or severe elongation. Second, assess the overall density and contrast to ensure visibility of hard and soft tissues. Third, confirm that the entire region of interest is captured without significant distortion. Fourth, and most importantly, evaluate whether any identified technical imperfections impede the diagnostic interpretation of the image. If any of these steps reveal a compromise in diagnostic quality, the professional obligation is to retake the radiograph to ensure the highest standard of patient care and accurate diagnosis. Question 11. Performance analysis shows that during a routine prophylaxis, an expanded functions dental assistant EFDA observes a small, asymptomatic pigmented lesion on the buccal mucosa that is not related to the patient's current dental complaint. The EFDA has received training in identifying oral abnormalities. What is the most appropriate course of action for the EFDA? Option A. Make a note in the chart to reevaluate the lesion at the patient's next scheduled appointment. Option B. Document the lesion's characteristics in the patient's chart and immediately inform the supervising dentist of the observation. Option C. Attempt to remove the lesion as it appears to be superficial. Option D. Advise the patient that the lesion is likely benign and not to worry about it. The correct answer is B. Document the lesion's characteristics in the patient's chart and immediately inform the supervising dentist of the observation. Explanation. Scenario analysis. This scenario presents a professional challenge because the expanded functions dental assistant, EFDA, has observed a potential abnormality that falls outside their direct scope of treatment, but is clearly visible during a routine procedure. The difficulty lies in balancing the immediate need to address the patient's well-being with the strict boundaries of their professional role and the established protocols for reporting and referral. Misjudgment could lead to patient harm if the abnormality is serious and goes unreported, or it could lead to overstepping professional boundaries and undermining the dentist's authority and the established patient care pathway. Correct approach analysis. The correct approach involves meticulously documenting the observed abnormality in the patient's chart, noting its location, appearance, and any relevant patient-reported symptoms, and then immediately and clearly communicating these findings to the supervising dentist. This represents best professional practice because it adheres to the principle of patient advocacy by ensuring that a potentially significant finding is brought to the attention of the primary clinician responsible for diagnosis and treatment planning. It also respects the scope of practice for an EFDA, which includes observation and documentation, but not independent diagnosis or treatment of conditions outside their authorized functions. This aligns with regulatory frameworks that emphasize clear communication and collaboration within the dental team to ensure comprehensive patient care. Incorrect approach is analysis. One incorrect approach is to ignore the finding, assuming it is minor or unrelated to the current treatment. This is a failure of professional responsibility and patient advocacy. Ethically, it breaches the duty of care owed to the patient, as a potentially serious condition could be missed, leading to delayed diagnosis and treatment and potentially worse patient outcomes. Regulatory frameworks typically mandate reporting of observed conditions that could impact oral health. Another incorrect approach is to attempt to diagnose the abnormality or suggest treatment options to the patient. This is a direct violation of the EFDA scope of practice. It undermines the dentist's role and could lead to misinformation or anxiety for the patient. Regulatory bodies strictly define the procedures an EFDA is authorized to perform. An independent diagnosis is not among them. This action could result in disciplinary action and damage the professional relationship with the dentist. A third incorrect approach is to document the finding but fail to communicate it to the dentist, perhaps due to time constraints or a belief that the dentist will discover it independently. While documentation is important, the primary ethical and regulatory obligation is to ensure the information reaches the responsible clinician. This failure to communicate creates a gap in patient care and could be considered negligence if the abnormality progresses due to the lack of timely intervention. Professional reasoning. Professionals in this situation should employ a decision-making process that prioritizes patient safety and adheres to established professional and regulatory guidelines. This involves a systematic approach. 1. Observe and identify. Recognize deviations from normal oral anatomy or tissue. 2. Document accurately. Record objective findings including location, size, color, texture, and any patient-reported symptoms. 3. Communicate promptly. Inform the supervising dentist immediately and clearly about the observation. 4. Follow protocol. Adhere to the dental practice's established procedures for reporting and referral of such findings. 5. Maintain scope of practice. Understand and respect the boundaries of one's professional role, focusing on observation, documentation, and assisting, rather than diagnosing or treating. Question 12. Market research demonstrates that patients often express significant anxiety and ask detailed questions regarding dental procedures, particularly those involving restorative work or surgical interventions. An expanded functions dental assistant (EFDA) is preparing a patient for a procedure, and the patient expresses apprehension, asking for a detailed explanation of why this specific material was chosen over others and what the long-term prognosis is for the tooth if this treatment is not successful. The EFDA has been trained in the application of the chosen material and understands its general benefits. Which of the following represents the most appropriate response for the EFDA? Option A. Clearly explain the general benefits and application of the chosen material as per their training. Reiterate the dentist's assessment that this is the recommended course of action, and offer to relay any further specific questions about diagnostic reasoning or prognosis to the dentist for their direct response. Option B. Provide a comprehensive explanation of all available restorative materials, including their comparative long-term prognoses, and offer personal opinions on which material might be superior based on anecdotal experience. Option C. Explain that the dentist is too busy to answer further questions and that the EFDA is not authorized to discuss treatment options or prognoses, leaving the patient with no further clarification. Option D. Reassure the patient that the dentist is highly skilled and that they should not worry without providing specific information about the material or the procedure, and then proceed with preparing the patient. The correct answer is A. Clearly explain the general benefits and application of the chosen material as per their training. Reiterate the dentist's assessment that this is the recommended course of action, and offer to relay any further specific questions about diagnostic reasoning or prognosis to the dentist for their direct response. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the expanded functions dental assistant (EFDA) to navigate a patient's anxiety and potential misinformation, while adhering strictly to the scope of practice defined by the relevant dental board regulations. The EFDA must balance providing accurate, reassuring information with avoiding the unauthorized practice of dentistry or offering opinions outside their defined expertise. The patient's emotional state can influence their perception of information, making clear, empathetic communication crucial. Correct approach analysis. The correct approach demonstrates best professional practice by empowering the patient with accurate, accessible information within the EFDA-authorized scope. This involves clearly explaining the procedure in understandable terms, reiterating the dentist's role and the rationale for the treatment, and offering to relay specific questions to the dentist. This aligns with ethical principles of patient autonomy and informed consent, as well as regulatory requirements that define the EFDA responsibilities and limitations. By focusing on what the EFDA is permitted to explain and facilitating communication with the dentist for more complex inquiries, the EFDA upholds professional boundaries and ensures the patient receives comprehensive care. Incorrect approaches analysis. An approach that involves the EFDA attempting to explain complex diagnostic findings or treatment alternatives beyond their training and licensure constitutes the unauthorized practice of dentistry. This is a direct violation of dental board regulations and ethical standards, as it can lead to misdiagnosis, inappropriate treatment, and harm to the patient. An approach where the EFDA dismisses the patient's concerns or provides vague, unhelpful responses fails to meet the ethical obligation of patient care and communication. This can erode patient trust, increase anxiety, and potentially lead to noncompliance with treatment. It also fails to leverage the EFDA role in facilitating patient understanding and support. An approach that involves the EFDA speculating on the dentist's personal opinions or motivations regarding the treatment is unprofessional and unethical. EFDA are not privy to the dentist's internal thought processes and should not represent them as such. This can lead to misinterpretations and damage the patient-dentist relationship. Professional reasoning. Professionals should first assess the patient's emotional state and the nature of their concerns. They should then identify what information they are authorized and competent to provide based on their specific role and regulatory framework. If the concern falls outside their scope, the professional should clearly state this and offer to facilitate communication with the appropriate party, in this case, the dentist. Empathy, clarity, and adherence to professional boundaries are paramount in ensuring patient well-being and maintaining regulatory compliance. Question 13. Analysis of a situation where an expanded functions dental assistant EFDA observes a suspicious lesion on a patient's oral mucosa during a routine prophylaxis appointment, which is beyond the EFDA-authorized scope for diagnosis and treatment planning. The EFDA has completed all authorized preventive procedures. What is the most appropriate course of action for the EFDA? Option A. Document the observation in the patient's chart, noting its location, size, and appearance, and immediately inform the supervising dentist of the finding for their professional evaluation and management. Option B. Inform the patient that the lesion is not within the EFDA scope to address and that they should monitor it themselves for any changes. Option C. Advise the patient that the lesion appears concerning and suggest they schedule an appointment with a specialist for further examination. Option D. Proceed with additional preventive procedures, assuming the lesion is benign and not relevant to the current appointment scope. Correct answer is A. Document the observation in the patient's chart, noting its location, size, and appearance, and immediately inform the supervising dentist of the finding for their professional evaluation and management. Explanation. This scenario presents a professional challenge due to the critical nature of patient assessment and management, particularly when an expanded functions dental assistant EFDA is involved in identifying potential issues beyond their direct scope of practice. The EFDA must exercise sound judgment to determine the appropriate level of intervention and communication without overstepping their authorized duties or causing undue patient alarm. The core of the challenge lies in balancing proactive patient care with adherence to regulatory boundaries and the dentist's ultimate responsibility. Correct approach represents best professional practice because it prioritizes patient safety and well-being by ensuring that a potentially significant finding is brought to the attention of the supervising dentist in a timely and appropriate manner. This aligns with the ethical obligation to act in the patient's best interest and the regulatory framework that defines the EFDA role in assisting the dentist. By documenting the observation and communicating it directly to the dentist, the EFDA fulfills their duty of care and facilitates the dentist's comprehensive assessment and management plan, adhering to the principle of direct supervision. An incorrect approach that involves the EFDA attempting to diagnose or provide definitive treatment recommendations would represent a significant regulatory and ethical failure. This oversteps the EFDA scope of practice, which is defined by state dental practice acts and board regulations. Such actions could lead to misdiagnosis, inappropriate treatment, and potential harm to the patient, violating the principle of do no harm and undermining the dentist's authority and responsibility. Another incorrect approach, such as ignoring the finding or failing to report it to the dentist, constitutes a breach of professional duty and negligence. This failure to act directly jeopardizes patient care and violates the implicit trust placed in dental professionals. It also fails to uphold the regulatory requirement for EFDA to assist the dentist in patient management. The professional decision-making process for similar situations should involve a clear understanding of one's scope of practice as an EFDA, a commitment to patient-centered care, and a strong communication protocol with the supervising dentist. When an EFDA observes something that falls outside their direct treatment responsibilities but appears to be a potential health concern, the decision-making framework should be: 1. Recognize the observation. 2. Assess if it falls within the EFDA authorized scope of practice for assessment or reporting. 3. If it does not fall within direct treatment scope but warrants attention, document the observation accurately. 4. Communicate the observation clearly and concisely to the supervising dentist, allowing the dentist to make the diagnosis and treatment decisions. This systematic approach ensures patient safety, regulatory compliance, and ethical conduct. Question 14. Quality control measures reveal that an expanded functions dental assistant EFDA is performing intraoral and extraoral examinations. Which of the following approaches best aligns with regulatory requirements and professional best practices for this procedure? Option A. Performing the examination based on the EFDA personal experience and intuition, documenting only those findings that appear unusual or potentially problematic. Option B. Conducting the examination using a standardized checklist, meticulously documenting all observed findings, both normal and abnormal, and reporting any deviations from normal to the supervising dentist. Option C. Relying solely on the patient's self-reported symptoms to guide the examination and documenting only the areas the patient indicates as sensitive. Option D. Interpreting all observed findings and providing a preliminary diagnosis to the patient before consulting with the supervising dentist. The correct answer is B. Conducting the examination using a standardized checklist, meticulously documenting all observed findings, both normal and abnormal, and reporting any deviations from normal to the supervising dentist. Explanation: this scenario presents a professional challenge because the expanded functions dental assistant EFDA is tasked with performing a critical diagnostic step, the intraoral and extraoral examination, which requires a high degree of observational skill, knowledge of anatomical structures, and understanding of potential pathological signs. The challenge lies in ensuring the examination is comprehensive, accurate, and documented appropriately, adhering to established protocols and the dentist's instructions, while also recognizing limitations and knowing when to escalate findings. Careful judgment is required to differentiate normal anatomical variations from potentially concerning abnormalities. The correct approach represents best professional practice because it demonstrates a systematic, thorough, and evidence-based method for conducting the examination. This involves adhering to the dentist's specific instructions, utilizing a standardized checklist or protocol to ensure all areas are covered, and meticulously documenting all findings, both normal and abnormal. This aligns with regulatory requirements for accurate patient records and ethical obligations to provide competent care. By focusing on objective observations and clear documentation, the EFDA ensures that the dentist has the necessary information for diagnosis and treatment planning, thereby upholding patient safety and quality of care. An incorrect approach that involves performing the examination without a clear protocol or checklist is a significant regulatory and ethical failure. It increases the risk of overlooking critical findings, leading to delayed diagnosis and treatment, which directly compromises patient safety. This lack of systematic approach violates the principle of providing competent care and can be seen as negligence. Another incorrect approach, such as documenting only abnormal findings while omitting normal ones, is also a failure. Comprehensive documentation, including normal findings, establishes a baseline for future comparisons and demonstrates the thoroughness of the examination, which is a regulatory requirement for accurate record-keeping. Failing to do so can lead to misinterpretations of future examinations. Finally, an approach that involves making diagnostic judgments or offering definitive diagnoses beyond the EFDA scope of practice is a severe ethical and regulatory violation. EFDA are trained to observe and report, not to diagnose, and overstepping these boundaries can lead to incorrect diagnoses and inappropriate treatment, posing a direct risk to the patient and violating professional scope of practice regulations. Professionals should employ a decision-making framework that prioritizes patient safety and adherence to regulatory guidelines. This involves understanding the scope of practice for an EFDA, following established protocols for examinations, maintaining meticulous documentation, and recognizing the importance of clear communication with the supervising dentist. When faced with uncertainty or unusual findings, the professional decision-making process should involve consulting with the supervising dentist immediately, rather than attempting to interpret or diagnose independently. This ensures that all findings are reviewed by the appropriate licensed professional and that patient care remains within established legal and ethical boundaries. Question 15. Operational review demonstrates that a new patient presents with moderate plaque accumulation and expresses a desire to improve their oral hygiene at home. The expanded functions dental assistant EFDA has a limited time frame before the dentist's examination. Which of the following approaches best aligns with professional standards for providing oral hygiene instructions and dietary counseling in this situation? Option A. Focus primarily on the dentist's upcoming examination, assuring the patient that the dentist will address any oral hygiene concerns during their assessment. Option B. Engage the patient in a brief discussion about their current brushing and flossing habits, demonstrate proper technique for brushing and interdental cleaning, and offer one specific, achievable dietary modification to reduce sugar intake, while confirming the patient's understanding. Option C. Hand the patient a generic brochure on healthy eating and instruct them to eat better without further elaboration or assessment of their current diet. Option D. Provide the patient with a comprehensive oral hygiene pamphlet and a list of recommended toothpastes, briefly mentioning the importance of flossing. The correct answer is D. Provide the patient with a comprehensive oral hygiene pamphlet and a list of recommended toothpastes, briefly mentioning the importance of flossing. Explanation. This scenario presents a common challenge in dental practice, ensuring effective patient education on oral hygiene and diet, particularly when faced with time constraints and diverse patient needs. The professional challenge lies in balancing the need for comprehensive instruction with the practical realities of a busy clinic, while adhering to established professional standards and ethical obligations. Careful judgment is required to tailor advice, assess patient comprehension, and document interventions appropriately. The correct approach represents best professional practice because it prioritizes patient-centered care and evidence-based education. By actively engaging the patient, assessing their current habits, and providing personalized, actionable advice, the EFDA empowers the patient to take ownership of their oral health. This aligns with the ethical principle of beneficence, acting in the patient's best interest and autonomy, respecting the patient's right to make informed decisions. Furthermore, it reflects the regulatory expectation that dental professionals provide adequate patient education to promote oral health and prevent disease. Documenting the instructions given and the patient's understanding is crucial for continuity of care and legal protection. An incorrect approach that focuses solely on providing generic pamphlets fails to acknowledge individual patient needs and learning styles. This approach is ethically deficient as it may not lead to actual behavior change, and therefore may not be in the patient's best interest. It also falls short of the regulatory expectation for effective patient education, potentially leading to suboptimal oral health outcomes. Another incorrect approach that involves rushing through instructions without assessing comprehension is professionally unacceptable. This demonstrates a lack of respect for the patient's autonomy and may result in the patient not understanding or retaining the information, thus failing to achieve the goal of improved oral hygiene. Ethically, it breaches the duty of care by not ensuring the patient is adequately informed. Finally, an approach that omits documentation of the oral hygiene and dietary counseling provided is a significant regulatory and ethical failure. Proper documentation is essential for tracking patient progress, communicating with other healthcare providers, and fulfilling legal and professional responsibilities. Without documentation, it is difficult to demonstrate that adequate care was provided, potentially leading to professional liability. Professionals should approach patient education by first establishing rapport and assessing the patient's current knowledge and habits. This allows for tailored advice that is relevant and achievable. Active listening and encouraging questions are vital for ensuring comprehension. The decision-making process should involve considering the patient's individual circumstances, learning preferences, and any barriers to adherence, and then providing clear, concise, and actionable recommendations, followed by appropriate documentation. Question 16. Research into the ethical responsibilities of an expanded functions dental assistant EFDA reveals a scenario where a patient's blood pressure was recorded as 120/80 mmHg by the dentist earlier in the day. Upon rechecking the patient's blood pressure before a scheduled procedure, the EFDA obtains a reading of 145/95 mmHg. The EFDA is confident in their measurement technique and the accuracy of the equipment. What is the most appropriate course of action for the EFDA in this situation? Option A. Record the new reading of 145/95 mmHg, but do not mention the discrepancy to the dentist, as it might cause unnecessary alarm. Option B. Document the earlier reading of 120/80 mmHg in the patient's chart, assuming the new reading was an error. Option C. Immediately inform the supervising dentist of the new, higher blood pressure reading and the discrepancy with the earlier measurement. Option D. Proceed with the scheduled procedure, as the dentist had already assessed the patient earlier and deemed them stable. Correct answer is C. Immediately inform the supervising dentist of the new, higher blood pressure reading and the discrepancy with the earlier measurement. Explanation. This scenario presents a professional challenge because the expanded functions dental assistant, EFDA, is faced with conflicting information regarding a patient's vital signs. The dentist's initial assessment based on a prior reading suggests a stable patient, while the EFDA current, accurate measurement indicates a potentially concerning deviation. The professional challenge lies in the EFDA responsibility to accurately record and report patient data, even when it contradicts previous findings or the dentist's initial impression, and to do so in a manner that ensures patient safety without undermining the dentist's authority. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the core ethical and regulatory principles governing dental assisting. Accurately measuring and recording vital signs is a fundamental responsibility of an EFDA. When a discrepancy is noted, the EFDA has a professional obligation to report the current, accurate findings to the dentist immediately. This ensures the dentist has the most up-to-date and accurate information to make informed clinical decisions, potentially altering the treatment plan to safeguard the patient's well-being. This aligns with the regulatory framework that mandates EFDA to perform expanded functions under the supervision of a licensed dentist and to maintain accurate patient records. An incorrect approach of ignoring the discrepancy or assuming the initial reading was correct would be a significant regulatory and ethical failure. It demonstrates a lack of diligence in performing a core duty and could lead to patient harm if the elevated vital signs indicate an underlying issue that requires immediate attention or modification of treatment. This failure to accurately assess and report patient data violates the principle of patient advocacy and could be considered a breach of professional conduct, potentially leading to disciplinary action by the licensing board. Another incorrect approach of documenting the dentist's initial reading as the current vital signs, despite having obtained a different measurement, is a direct falsification of patient records. This is a severe ethical and regulatory violation, undermining the integrity of the patient chart and potentially leading to incorrect medical management. It also erodes trust between the EFDA, the dentist, and the patient. A third incorrect approach of only reporting the discrepancy without taking any further action or remeasuring would also be professionally deficient. While reporting is crucial, the EFDA should also be prepared to re-verify their own measurement and be ready to assist the dentist in further assessment, demonstrating a proactive approach to patient care. A professional decision-making process for similar situations should involve a clear understanding of one's scope of practice and responsibilities. When a discrepancy in patient vital signs is encountered, the EFDA should 1. Ensure their own measurement technique is accurate and the equipment is functioning correctly. 2. Remeasure the vital sign to confirm the reading. 3. Immediately and clearly communicate the current, accurate vital sign reading to the supervising dentist, highlighting the discrepancy with any previous readings. 4. Be prepared to provide further assistance as directed by the dentist. This systematic approach ensures patient safety, upholds professional integrity, and complies with regulatory requirements. Question 17. Cost-benefit analysis shows that investing in advanced radiographic interpretation training for expanded functions, dental assistance EFDA, yields significant improvements in diagnostic support. An EFDA reviews a periapical radiograph of a patient presenting with mild discomfort in the posterior mandible. The radiograph clearly shows an unerupted third molar. The EFDA also notes a radiopaque structure adjacent to the apex of the unerupted tooth, which appears to be a developing supernumerary tooth. The EFDA responsibility is to accurately describe the radiographic findings to the supervising dentist. Which of the following best describes the EFDA accurate radiographic interpretation? Option A. The radiograph reveals an unerupted third molar and a developing supernumerary tooth adjacent to its apex. Option B. The radiograph shows an unerupted third molar with a periapical radiolucency that may indicate infection. Option C. The radiograph displays an unerupted third molar, but the adjacent radiopaque structure is likely artifact. Option D. The radiograph appears normal with no significant findings requiring further attention. The correct answer is A. The radiograph reveals an unerupted third molar and a developing supernumerary tooth adjacent to its apex. Explanation. This scenario is professionally challenging because the expanded functions dental assistant EFDA is tasked with interpreting radiographic anatomy and landmarks, a responsibility that requires a nuanced understanding beyond simple image acquisition. The challenge lies in accurately identifying and differentiating normal anatomical structures from potential pathological findings, which directly impacts diagnostic accuracy and subsequent treatment planning. The EFDA must possess a strong foundation in radiographic interpretation to ensure patient safety and the provision of high-quality care, adhering strictly to the scope of practice defined by the relevant regulatory body. The correct approach represents best professional practice because it demonstrates a commitment to accurate radiographic interpretation and patient care within the defined scope of practice for an EFDA. By correctly identifying the unerupted third molar and its relationship to the inferior alveolar canal, the EFDA is providing crucial information that aids the dentist in diagnosis and treatment planning. This aligns with regulatory guidelines that permit EFDA to perform expanded functions, which often include assisting in radiographic interpretation under the supervision of a licensed dentist. This action upholds ethical principles of competence and diligence. An incorrect approach that involves misidentifying the unerupted third molar as a periapical radiolucency would be a significant regulatory and ethical failure. This misinterpretation could lead to unnecessary and potentially harmful interventions, such as endodontic treatment or extraction of a healthy tooth, directly violating the principle of do no harm, non-maleficence. It also demonstrates a lack of competence in radiographic interpretation, falling outside the expected standard of care for an EFDA. Another incorrect approach, such as failing to identify the unerupted third molar altogether and reporting the radiograph as showing no significant findings, would also constitute a regulatory and ethical failure. This omission could delay the diagnosis of a developing pathology or an impacted tooth that requires management, potentially leading to complications and negatively impacting patient outcomes. This failure to identify a significant anatomical structure and its potential implications breaches the duty of care owed to the patient. The professional decision-making process for similar situations should involve a systematic approach to radiographic interpretation. First, the EFDA must review the radiograph with a thorough understanding of normal radiographic anatomy and landmarks, including the appearance of teeth, bone, nerves, and sinuses. Second, they should compare the observed findings against their knowledge base, differentiating between expected anatomical variations and potential abnormalities. Third, if any uncertainty exists or if a finding appears significant, the EFDA must consult with the supervising dentist for confirmation and further evaluation. This iterative process ensures accuracy, patient safety, and adherence to professional standards and regulatory requirements. Question 18. Stakeholder feedback indicates a need to clarify the appropriate use of temporary restorations in specific patient scenarios. An expanded functions dental assistant EFDA is presented with a patient who requires a temporary filling due to a fractured cusp. The patient has a known history of sensitivity to certain acrylic resins. The EFDA also notes signs of potential, but not definitive, pulpal inflammation. Considering the indications and contraindications for temporary restorations, which of the following actions best reflects professional and regulatory best practices? Option A. Inform the patient that temporary restorations cannot be used due to their sensitivity and the potential pulpal inflammation, and await further instructions from the dentist without any immediate action. Option B. Apply a temporary restoration using a standard material, assuming the patient's sensitivity is not severe enough to warrant deviation from the typical procedure. Option C. Place a temporary restoration immediately using the most readily available material to address the fractured cusp, as the patient's sensitivity is a minor concern. Option D. Proceed with placing a temporary restoration using a material known to be well tolerated by the patient, after consulting with the supervising dentist regarding the potential pulpal inflammation. The correct answer is D. Proceed with placing a temporary restoration using a material known to be well tolerated by the patient, after consulting with the supervising dentist regarding the potential pulpal inflammation. Explanation: this scenario is professionally challenging because it requires the expanded functions dental assistant, EFDA, to exercise clinical judgment based on a patient's specific condition and medical history, rather than a one-size-fits-all approach. The EFDA must balance the need for a temporary restoration to protect the tooth and maintain function with potential risks that could compromise patient health or treatment outcomes. This necessitates a thorough understanding of both the indications for and contraindications of temporary restorations, as outlined by the relevant Dental Practice Acts and board regulations governing EFDA scope of practice. The correct approach represents best professional practice because it prioritizes patient safety and well-being by adhering strictly to the established indications and contraindications for temporary restorations. This aligns with the ethical obligation to provide competent care and avoid harm, as mandated by professional dental standards and regulatory bodies. By carefully assessing the patient's condition, the EFDA ensures that the temporary restoration serves its intended purpose without exacerbating existing issues or creating new ones, thereby upholding the integrity of the treatment plan and the patient's oral health. This also reflects compliance with the scope of practice for EFDA, which is defined by state dental boards and requires them to operate within their authorized duties. An incorrect approach that involves placing a temporary restoration without considering the patient's allergy to a component of the temporary material would be a significant regulatory and ethical failure. This directly violates the principle of do no harm and could lead to a severe adverse patient reaction, constituting professional negligence. It also demonstrates a failure to adhere to the established contraindications for temporary restorations, which would be detailed in state dental board regulations and potentially in manufacturer guidelines for the materials used. Another incorrect approach, such as placing a temporary restoration on a tooth with a confirmed, active, untreated infection without consulting the supervising dentist, is also a critical failure. This bypasses essential diagnostic and treatment steps, potentially allowing the infection to spread and worsen, leading to more complex and serious health consequences for the patient. This action would likely exceed the EFDA scope of practice, as managing active infections typically falls under the purview of the dentist, and would be a violation of regulations concerning patient care protocols and the dentist's supervisory responsibilities. The professional decision-making process for similar situations should involve a systematic evaluation. First, the EFDA must identify the patient's chief complaint and the presenting clinical situation. Second, they must consult the established indications and contraindications for the proposed procedure, referencing their training, the dentist's instructions, and relevant state regulations. Third, they must assess the patient's medical history, including allergies and current health status, for any factors that might contraindicate the procedure. Fourth, if any doubt or contraindication arises, the EFDA must communicate with the supervising dentist for guidance and authorization before proceeding. This collaborative approach ensures that patient safety is paramount and that all actions are within the scope of practice and regulatory compliance. Question 19. Which approach would be most compliant with expanded functions dental assistant EFDA regulations and best practices when preparing a tooth surface for sealant application, including the application of etchant, sealant material, and curing procedures? Option A. Apply etchant directly to the tooth without isolating the surrounding soft tissues. Rinse briefly, apply sealant material, and cure for a minimal duration. Option B. Isolate the tooth. Apply etchant, rinse and dry, apply sealant material, and then proceed to the next patient while the sealant cures. Option C. Apply etchant, rinse and dry, then immediately apply sealant material without ensuring complete dryness of the tooth surface, followed by curing. Option D. Isolate the tooth, apply etchant to the prepared enamel, rinse and dry thoroughly, apply sealant material to the occlusal surfaces, and cure according to manufacturer instructions. The correct answer is D. Isolate the tooth, apply etchant to the prepared enamel, rinse and dry thoroughly, apply sealant material to the occlusal surfaces, and cure according to manufacturer instructions. Explanation. The scenario of applying etchant, sealant material, and performing curing procedures presents a professionally challenging situation due to the direct impact on patient oral health and the potential for procedural errors. EFDA must possess a thorough understanding of the materials, techniques, and regulatory guidelines to ensure efficacy and patient safety. The critical nature of these steps lies in their role in preventing caries and maintaining the integrity of the dental restoration. Precise application and adherence to manufacturer instructions and state board regulations are paramount. The correct approach represents best professional practice because it prioritizes patient well-being and adheres strictly to established protocols and regulatory mandates. This involves meticulous isolation of the operative field, precise application of the etchant to the prepared tooth surface, thorough rinsing and drying to remove all etchant residue, and careful placement of the sealant material to cover the occlusal surfaces without voids or excess. Proper curing, following the manufacturer's recommended time and distance, is essential for the sealant's polymerization and long-term effectiveness. This comprehensive approach minimizes the risk of post-operative sensitivity, sealant failure, and secondary caries, aligning with the EFDA scope of practice as defined by the relevant state dental board regulations. An incorrect approach that involves skipping the isolation step before etching would be a regulatory and ethical failure. Isolation is crucial to prevent etchant from contacting soft tissues, which can cause burns or irritation, and to ensure a clean, dry surface for optimal sealant adhesion. Failure to rinse and dry thoroughly after etching can lead to a weak bond and premature sealant failure, compromising the preventive outcome. Applying sealant material without proper curing would render the sealant ineffective, as it would not harden and would wash away, failing to provide the intended caries protection. This directly violates the standard of care and the EFDA's responsibility to perform procedures competently and safely. Professional decision-making in similar situations should involve a systematic process. First, understanding the specific procedure and its objectives. Second, recalling and applying the relevant state dental board regulations and manufacturer instructions. Third, assessing the patient's individual needs and oral conditions. And finally, executing the procedure with precision, attention to detail, and a commitment to patient safety and optimal outcomes. Continuous education and staying updated on best practices are also vital components of professional responsibility. Question 20. The review process indicates that an expanded functions dental assistant EFDA is the first point of contact for a patient presenting with a new dental issue. The patient expresses discomfort and describes a sensation they are experiencing. What is the most appropriate initial action for the EFDA to take in assessing the patient's chief complaint and presenting symptoms? Option A. Actively listen to the patient's description of their complaint and symptoms. Ask clarifying and open-ended questions to gather detailed information and document these findings accurately and objectively. Option B. Immediately offer a presumptive diagnosis and suggest potential treatment options based on the initial description of the symptoms. Option C. Record a brief, general statement about the patient's discomfort without probing for specific details or duration of symptoms. Option D. Minimize the patient's reported symptoms, assuring them that it is likely a minor issue that will resolve on its own without further investigation. The correct answer is A. Actively listen to the patient's description of their complaint and symptoms, ask clarifying and open-ended questions to gather detailed information, and document these findings accurately and objectively. Explanation. Scenario analysis. This scenario is professionally challenging because the expanded functions dental assistant, EFDA, is tasked with initial patient interaction regarding their chief complaint and presenting symptoms. This requires not only active listening and empathy, but also the ability to accurately gather information that will be crucial for the dentist's diagnosis and treatment plan. Misinterpretation or incomplete information can lead to diagnostic errors, delayed treatment, or patient dissatisfaction, all of which have ethical and potentially regulatory implications. The EFDA must navigate the patient's subjective experience while remaining objective and focused on clinically relevant details. Correct approach analysis. The correct approach involves actively listening to the patient's description of their chief complaint and symptoms, asking clarifying and open-ended questions to elicit detailed information, and documenting these findings accurately and objectively. This aligns with the ethical responsibility to provide competent care and the regulatory requirement for accurate patient records. By thoroughly understanding the patient's concerns and symptoms, the EFDA facilitates a more efficient and accurate assessment by the dentist, ultimately benefiting patient care. This approach prioritizes patient-centered communication and meticulous documentation, which are foundational to safe and effective dental practice. Incorrect approaches analysis. An approach that involves immediately offering a presumptive diagnosis or suggesting specific treatments based on the initial complaint is incorrect. This oversteps the EFDA scope of practice, as diagnosis and treatment planning are the exclusive purview of the licensed dentist. Ethically, this is a breach of professional boundaries and could lead to patient harm if the presumptive diagnosis is inaccurate. It also undermines the dentist's role and responsibilities. Another incorrect approach is to dismiss or minimize the patient's reported symptoms, perhaps by stating they are probably nothing or not significant. This demonstrates a lack of empathy and can erode patient trust. Ethically, it fails to uphold the duty of care and can lead to a patient withholding important information due to feeling unheard. This could also have regulatory implications if a serious condition is missed due to insufficient information gathering. Finally, an approach that involves recording only a superficial or vague description of the chief complaint and symptoms, without seeking further detail, is also incorrect. This leads to incomplete patient records, which are a regulatory requirement. Inaccurate or insufficient documentation can hinder the dentist's ability to diagnose and treat effectively, and it can also be problematic in legal or professional reviews. Fails to meet the standard of care for thorough patient assessment. Professional reasoning. Professionals should employ a systematic approach to patient assessment. This begins with creating a welcoming and comfortable environment for the patient to express their concerns. The EFDA should then practice active listening, paying attention not only to what the patient says, but also to their nonverbal cues. Open-ended questions are crucial for encouraging detailed responses, while focused, clarifying questions help to gather specific, clinically relevant information. Documentation should be objective, accurate, and comprehensive, reflecting the patient's subjective experience and observable signs. This structured approach ensures that all necessary information is gathered efficiently and effectively, forming a solid foundation for the dentist's subsequent evaluation and treatment.